Welcome and good morning, and thank you for being here on such an exciting day. I'm Dr. Deborah Cohen, and I'm the Executive Director of the Amplify Center and the Co-Director of the Center for Youth Mental Health alongside Steve Sturkowski. We are here representing Dell Medical School, and we are both thankful to be here for the many stakeholders who've helped to move this vision of the center from the drawing board to this beautiful location. No one here needs to be told the profound impact that the COVID-19 pandemic has had on the lives of our fellow citizens. Many of us have lost friends or loved ones, knew folks who became incredibly ill and are still on the long road to recovery, or have experienced severe economic hardships despite our best actions. The mental health system in the United States was struggling to meet the basic needs of the population prior to 2020. And the virus brought a large segment of the system to a screeching halt. Nowhere was the onslaught of stress, trauma, and loneliness more felt acutely than our young population. We are fortunate in the recent years, the Texas legislature has invested heavily in children's mental health. In the narrow window of first episode psychosis, the funding landscape for young adults was threadbare. Importantly, the pandemic didn't cause the recent surge in young adult mental illness, rather as part of a perfect storm when paired with the chronically under and poorly served population. Further, no one here needs to be told of the cascading troubles that can follow from an untreated serious mental health issue at the time in a young person's life. Dropping out of school, justice involvement, chronic underemployment, strained relationships, the list can go on. But you all realize that it didn't have to be this way. You realize that a young person in crisis doesn't have to tough it out on their own, and help doesn't have to be inaccessible. That's the animating mindset behind the Amplify Center. Through the generous investment from the Michael and Susan Dell Foundation, my team at the Center for Youth Mental Health engaged with youth and young adults trying to access the mental health care in our community. And we analyzed trends to figure out what was missing. The result was a developmentally attuned, integrated, and multidisciplinary drop-in center similar to those that has proven to be so successful in other countries. By prioritizing multidisciplinary early intervention in an environment that's friendly to this unique group of young adults, this model has led to fantastic results elsewhere, and we're specifically very excited to do it here in Texas. From this idea, an exciting partnership became shaped between the Austin Community College and Dell Medical School, with ACC stepping up to provide us this wonderful space at Eastview campus. This space, the first young adult specific mental health clinic in Texas, will provide the opportunity for quality mental health care to a medically underserved population. This is nothing short of incredible, and it would not have been possible without our generous supporters and donors who are here today. I want to thank each of them. First, we start with, I want to thank Love Tito's, Margaret Jabor, and Twin Liquors, the Trace Grace Foundation. We want to thank you for your generous support. And through this generous support, alongside with the wonderful students of Creative Action and the furnishings provided from Jeff Young, we are able to beautify our space and make it incredibly welcoming to the numerous students who we will serve in this location. I also want to thank my leadership team. Laura Marola, Corey Morris, and Kaylee Emerson for your tireless efforts. And I publicly want to welcome our new Amplify clinical staff. And I also want to thank our wonderful partners at Integral Care, David Evans, Kathleen Casey, Julie Gerges, Sherry Bythe, and so many others who have worked with us endlessly to launch this opportunity. I also want to thank LifeWorks, NAMI, and the Emerging Voices Advocacy Council, who have been alongside the entire process and providing us input in every step of the way. And finally, I'd like to thank our team at Dell Medical School and the school's clinical practice, UT Health Austin, for their endless collaboration and support in launching this one-of-a-kind venture in our community. As we say at the University of Texas at Austin, what starts here changes the world. So hopefully, what starts here in this center will lead to many other resources, not only in Austin, in Texas, but across the country. We all know the cost-benefit estimate of allowing young persons to slide into mental illness, but this is more about dollars and cents. This is about quality of life. It's about human dignity. None of this would be possible and not for the work of those who are here today joining us. I speak for myself when I say thank you. I'd now like to hand it off to Chancellor Rhodes, who will speak on behalf of Austin Community College. Thank you.
All right. So Debbie said, what starts here changes the world. We say at ACC, start here and get there. So, this is a beautiful morning. Isn't this a great way to celebrate? Most of you may not know this, but we're in our 50-year anniversary at ACC, and so isn't this a great way to celebrate that? So thank you. So first, let me say thank you, Debbie, for all your hard work and for this grand partnership. It is amazing. So good morning, everyone. Thank you for joining us today. We talk a lot about the importance of supporting the whole student. And this partnership between Austin Community College, University of Texas at Austin, and the UT Dell Medical School is making that a reality here today. The Amplify Center was designed and created out of a real need to better support our students at ACC and their health. Debbie mentioned briefly, and I want to reiterate why we're here. National data show that depression among young college students are on the rise. Over the past decade, depression rates of high school students rose from 26 to 38%, and it's just been exacerbated as a result of the last 3 years of the pandemic. Students are having a hard time finding help and quality care. Our goal has always been to support our students and help them reach their goals. ACC's counseling team does an incredible job, and we're always looking, And we're always looking to see how we can do even more. We're honored to be a part of this new pilot program. Together, ACC, UT Austin, and Dell Medical School are working to help more individuals get the right care when they need it, when their symptoms are in their infancy. The fact that it's located here on our Eastview campus is essential. So our students who need support can get it immediately. And it's in addition to the robust counseling services that already exist at ACC, and all of it for free. Because we want to help the students foster life balance, develop personal and academic growth, and help maintain a safe and healthy learning environment. And we can provide this kind of wraparound support, we can make a difference. So I want to thank everyone who has made this possible, to Debbie Cohen and the entire team of the UT Dell Medical School and the University of Texas at Austin. To our Board of Trustees at ACC, some of whom are with us today. So the Chair of our Board of Trustees, Dr. Barbara Mink. Vice Chair of our Board of Trustees, Sean Hassan. And the newest member of our Board of Trustees, Steve Jacobs. To our Student Affairs team, with our Provost, Dr. Monique Humphrey, and Dr. Galen Scott, Dr. Gretchen Reel, Vice Chancellor Shasta Buchanan, sunning herself up above, Dr. Ruth Reinhardt, Sylvia Galvan Gonzalez. And I want to take time to say a special thank you to Garrett Groves for making all of this collaboration happen. And then each of our clinical counselors that are here, so give them a big round of applause. They all do amazing work. And without Dr. Molly Beth Malcolm here, who kind of makes things happen. It's because of your dedication that our students gain the support and confidence they need to achieve their dreams. It's partnerships like this that truly make me, ACC, proud. Now I'd like to welcome, and this is what I've been waiting for, I'd like to welcome one of our graduates who wanted to join us today to share her journey with you so that you can see firsthand the power of this type of a center. She is currently working at Copperas Cove High School, but she will be starting at UT Austin this summer. So please, and she just walked graduation in December, right? So join me, Adriana Calixto.
Ooh, I'm a little short here. All right, thank you so much, Dr. Rhodes, and good morning to everyone here that is attending this event today. It's an honor to be with all of you today. Like he mentioned, I am a graduate of ACC, and I am so proud of the journey to that finish line. I'd like to share a little bit with you about myself and who I am and how I got here. I am only 23 years old, and I'm a mom of 2 boys. My oldest is 4 years old. My youngest just turned 10 months old. I got pregnant in the middle of my senior year while in high school. And I remember thinking to myself, like, wow, you really did it. You're the pregnant girl in high school. And I was so hard on myself, and I convinced myself that I was never going to succeed. At that time, I didn't even envision a happy life for myself. Despite the negative thoughts, I pushed myself above my comfort level. I kept my pregnancy a secret. I went on with my everyday routine, going to dance practice and being the leader that I had to be. I competed in Hawaii for nationals and was able to finish my dance journey. 1 week before graduation, I announced that I was 5 months pregnant. And now looking back at that journey, I see things with a different lens. At that time, I truly thought that I would amount to nothing. And I assumed that I would never be able to go to college and that I would never be able to start a new life. I am so thankful that I did not let that become my reality. Instead, I enrolled at ACC, and here I was able to create a new life for myself. Yes, I was a single mom, and I was terrified of starting college. Not only was it the peak of COVID-19, but it was also the darkest point of my life, and I was very alone. When I started in summer of 2020, I took a course with Dr. Huerta. It was ACC's college success course, and Dr. Huerta became such a pivotal figure for me. She listened to me, and she saw me. And after explaining my personal struggles, she recommended that I reach out to ACC's counseling team. She submitted a referral for me, and I got the help that I needed. And from then on, I told myself that I could do anything. She really sparked something in me that I had not seen in a very long time. As I got closer to graduating, I saw how much that I had actually grown. I got married, I had another baby, and I started a wonderful job in special education. And I will be forever grateful for ACC and the support that I have received here. Helping students along their academic journey takes a lot more than tutoring in the classroom. I had teachers who saw me, all parts of me, and because they took that time to care, I got the guidance and supported that I needed. I do tear up thinking about how far I've come. This new center will mean a lot to many students who perhaps like me don't yet see their full potential. You are making brighter futures a reality one student at a time, and today I stand here tall and proud to say that I am Adriana Calixto. I'm an ACC graduate and I'm ACC proud. So yes. Thank you so much, everybody, truly, thank you. Thank you, I appreciate it, I truly do, thank you. It is now my honor to welcome Dr. Steve Strakowski, the Associate Vice President for Regional Mental Health at Dell Middle School.
I can't top that, so I'm not even going to try. So, great. So, Steve Strakowski, what does this mean? Associate Vice President of Regional Mental Health, a bizarre title that got created at the University of Texas 6 or 7 years ago to signify that at UT and Dell Medical School, we were committed to trying to change the landscape for mental health care in Central Texas and Austin, Travis County. And so I've had the fortune in this role to, any of you have seen the construction to the north of Central Market? It's truly going to be a complete sea change in how we take care of people in the Austin State Hospital. We're working with the Travis County to try to end the problem that our jail serves as a very, very bad waiting room for mental health services, and so that work's finally done. And then this project, and this one beat the others, got done first, so good job, Debbie. This one, again, arose out of this idea to transform the landscape of how we care for and think about people with mental illness in Texas and the United States, and particularly young people. This originated as the Center of Youth Mental Health that Debbie alluded to, with a very generous and visionary commitment from the Michael and Susan Dell Foundation that got us launched. The only useful thing is, senior leaders like people always wonder, what do we do? And it's often arguable whether we do anything. But the one good move I made here was steal Dr. Cohen from the School of Social Work and ask her to lead this project. We don't talk about it a lot, and the pandemic has sort of raised this specter that mental health's a problem, but you know what? I'm a practicing psychiatrist, by the way, which makes people start to get nervous, but it's not a new problem. We are in an epidemic of suicide in young people. People are dying. Mental illnesses are lethal, and we ignore it. And it's only because of the pandemic, frankly, that it finally was brought to fore. And, the pandemic said, hey, we have a problem with young people being sick. Well, that predated the pandemic by a decade. Minoritized people get crummy health care. You know what? That predated the pandemic by 200 years. And so maybe the time finally has come that we'll start paying attention to these things. This is not just another mental health clinic, and I think that's important. This is transformational. Where's the people who did the murals? Wonderful job, and that makes it different. But that's not what really makes it different. This is based on, so other piece of data, and then I'll quit doing data wonk stuff. But between 16 and 18, 90% plus of young people in mental health care abandon it. Because when they're 17, they're treated like they're 9, and when they're 18 and a day, they're treated like they're 40. And so they bail. And so this model was developed in Australia now 20 years ago by an old colleague of mine. And it's designed to bridge that 15 to 25-year-old gap by creating something that's designed by 15 to 25-year-olds as a place for them to go when they're starting to worry that something's wrong and they're not comfortable going to parents who often don't pay attention, frankly, or to get help from other people. It spread wildly through Australia, was picked up by their public health system, and then spread through the entire Western world, Japan, every other first world country except for one. The United States, because of our fragmented healthcare system, it hasn't been able to get a foothold. As of today, we got beat by a couple months. Us and Stanford just this year are launching the first 2 of these uniquely designed clinics to try to change how we address mental health issues with young people. And so people in this collaboration with ACC, University of Texas Health Austin, Dell Medical School, all our wonderful donors who I'm going to name in a minute, have created something that we hope will truly change the landscape for mental health care with all of the other things that we have going on. And so we should all be very proud of this for a little while and then get back to work, because there's a whole lot to do. So anyway, this is very, very exciting. And again, boy, am I excited that we're going to build from this. I want to thank the donors. I've already mentioned the Michael and Susan Dell Foundation. They took a chance when we were little more than an idea. It's like, we really need to change something. It's like, okay, we'll fund that. It's like, all right, thank you. Love Tito's, Trace Grace Family Foundation, Twin Liquors, Jeff Young donated the furniture. Thanks to all of you donors, and we are willing to take more, just in case you want. So if anybody here wants to donate, we will take more. The initial goal, by the way, of the philanthropic funding is to give us the time to run this, to figure out how do you pay for something like this in a fragmented healthcare system that takes very poor care of adolescents. That is what we do in this country, unfortunately. And so we're hoping to get enough runway to solve those problems, work with the legislature to change policy around how Medicare or Medicaid and insurances are used, and to make this part of our landscape. And so with all of that, I just want to, again, I've talked more than I probably was supposed to, but that's okay. This is a great day. This is one of the big things we're doing in Austin to lead the country in how we take care of people with mental illness, and I think be very proud of this. Thank you for everyone who's participated, and now I think my job is to release us to cut the ribbon, right? So thank you.
So we're going to do a quick ribbon cutting ceremony. So Steve and I, the Center for Youth Mental Health leadership team, and any donors who would like to join us up here, we would invite you towards the orange ribbon. Cut with big scissors. Yeah, cut with big scissors. And I got it. I'm good.